Good morning. We're going to give it a couple more minutes while we're admitting all the participants. So bear with us. It's right at 10 o'clock right now, so we'll probably give it a minute or two before we start. Thank you so much. All right, looks like the participant number is slowing down. Oh, no, never mind. It's still speeding up. So let's give it still another minute or so while we cycle everybody in. Thank you for joining us, though. So, all right, it's 10:02. Let's go ahead and get it going. Good morning, everybody. My name is Greg Tate, Section Chief over the Office of Strategic Partnership over here for the JI Initiative. And you are here with us for the CalAIM Reentry Initiative Learning Collaborative Office Hours. Thank you for joining us. If it's your first time, we appreciate you being here. If you've come to all the rest of the collaborative office hours and presentations, we appreciate you coming back. The meeting's going to be starting momentarily. Just letting you know, a little housekeeping. Your microphones will be muted while presenters are speaking. Please turn up your audio, and the Q&A feature, or raise your hand to share feedback and ask questions. I just saw in the chat that the Q&A feature is open and available right now, so you can start asking questions in there if you like. This session will be recorded and captioned. Caption recordings and transcripts will be posted on DHCS website within 7 to 10 days. Go ahead and go to the next slide, please. Again, today's October 10th, and this is our general office hours for the Reentry Initiative Learning Collaborative. You can go to the next slide. Thanks. We've had several of these sessions already, and I think they're doing really, really well with our interactive with our stakeholders. So we appreciate everybody coming. August 22nd, it kicked off with our first session, and it went great. And then a week after, we had our first office hour session. This is our third session's office hour. So today's 10:10, if you look on our list here for general office hours. And our next collaborative meeting will be session 4 on October 17th next week. It's for the non-behavioral health services. And following that, we'll have our correctional facility office hours and then our general office hours in concurrent to what this slide shows. So again, I appreciate you guys coming and listening and asking questions. This is how we're all gonna work together to ensure that this program is a success. And I will pass it along to our first presenter, Mrs. Megan Shandell. Thank you so much.
Thanks, Greg. Good morning, everyone. My name is Megan Shandell. I'm a Policy and Program Support Unit Chief working on the Justice Involved Reentry Initiative within our Office of Strategic Partnerships. Today, we're going to go through some pre-submitted questions and answers that DHCS has drafted. These questions were submitted as part of the previous Learning Collaborative and office hours sessions. Some of them are questions that we had to take back and research more fully. So if you have any additional questions, please drop them into the Q&A at this time. So the first one is, should correctional facilities require Medi-Cal eligibility expertise to manage the JI screening portal, or can personnel with operational expertise manage the portal? Anyone with administrative expertise can input information into the JI screening portal. Expertise in Medi-Cal is not required. Recorded trainings on the JI screening portal are available at the Medi-Cal Learning Portal webpage, which is linked on this slide. An eligibility specialist is required to manage the Medi-Cal application process and coordinate with the county social services department. Next question, please. What is the significance of the different kinds of JI aid codes? Each JI aid code is related to federal eligibility standards for the Medicaid program. The aid code is assigned by the county social services department that approves the Medi-Cal application. The county correctional facility is not responsible for assigning the JI aid code. Next question. Can a correctional facility activate the JI aid code before Medi-Cal enrollment is approved, especially in the case of an expedited short-term stay? Correctional facilities will not be able to activate the JI aid code until the individual is found eligible for Medi-Cal. The correctional facility should work directly with the county social services department to expedite the Medi-Cal application submission process when necessary. Alternatively, correctional facilities are encouraged to submit an application through Covered California or Benefits Cal for an accelerated enrollment, which provides temporary Medi-Cal to individuals until the application has been adjudicated, as long as the individual attests to their eligibility information, including income. Next question. What is the difference between the JI screening portal and the PAVE portal? The JI screening portal is designed for correctional facilities and DHCS to track and update member eligibility in order to activate pre-release benefits. The PAVE portal is designed to enroll correctional facility or other entities as a Medi-Cal provider. Next question. Can providers split a care management bundle for billing? Yes, providers can bill for individual elements of a bundle. DHCS will provide additional information on splitting care management bundle billing on the November 14th care management webinar. Next question. Can county behavioral health agencies bill for behavioral health links on behalf of individuals who are in a county correctional facility that has not yet gone live? County behavioral health agencies will be expected to provide services to individuals returning to their county of residence only from county correctional facilities that have already gone live. If the county correctional facility has not yet gone live, then the JI aid code has not been activated for the individual, and the county behavioral health agency will not be able to bill for services. DHCS plans to release additional guidance for county behavioral health agencies to clarify our expectations. Next question. What is the process for incarcerated individuals to be assigned to a Medi-Cal managed care plan? And then how will managed care plans know which individuals in their plan are incarcerated? So individuals not enrolled in Medi-Cal prior to incarceration will be enrolled in Medi-Cal and auto-assigned a managed care plan. This will be triggered by the aid code activation in the JI screening portal. DHCS will use existing auto-assignment policy, including prior managed care plan enrollment and family member assignment, to make assignments, and individuals will be offered a choice period after their release. Incarcerated individuals with an assigned managed care plan and a hold status will be noted as such in the daily monthly 834 file, which DHCS shares with managed care plans. This will be for any JI incarcerated Medi-Cal member with a suspended primary aid code and managed care plan, not just those receiving pre-release services. The JI indicator on the 834 file, applied when the JI pre-release service aid code is activated, will notify the plan of their enrolled members who are actively receiving JI benefits during incarceration. Next question, please. Awesome. So we breezed through those fairly quickly, and now we're going to open it up for a time of live Q&A. You may use the Q&A feature to enter your questions, and someone from our team will answer them. We may choose to answer some of those live. You may also raise your hand, and we will work to call on you guys.
Wonderful. Good morning, everyone. This is Maya Shasha from Manat Health. I'm going to help facilitate some of the written Q&A. And as Megan said, please make sure to send in your Q&A using the Q&A feature. And we'll work through the questions we've got coming in. There's already a bunch. So the first question, I think I'll pass to Sarah Linder. It is asking for a bit of clarification on how the JI portal will handle NOAs for pauses, restarts, resets, and whether county social services will need to generate the NOA for each change.
Good morning, everyone, and thanks for your questions, Siskiyou. So our JI screening portal will establish a mailing file that DHCS will actually use to issue the notices of action, or NOAs, for those familiar. So essentially, anytime an aid code is activated or turned on, DHCS will be issuing an approval NOA, which will inform the member of their approval effective date and also of their projected termination date based on the information that was added to the portal and how those are calculated. The social services departments will not be doing any notice of action generations or even managing of the JI aid codes. Those will all be managed in conjunction between DHCS and our county correctional facility partners. In addition to the approval NOAs, DHCS will also be issuing denial notices for anyone that the correctional facilities have reported were screened but not found eligible for the pre-release services. Within both of those NOAs, they will also be receiving hearing rights so that they're aware of what benefits or what rights they have as far as it relates to the program. I do see Ron with his hand up, so perhaps there's a follow-up.
Yes, thank you very much, Sarah. So just want to make sure I have this right. So the usual regulatory requirements for social services doing notices of action is waived when they're using the JI portal. Is that?
So we're not actually, the social services departments would only be responsible for issuing NOAs for programs in which you're administering eligibility for. So think of JI like our presumptive eligibility programs that DHCS manages, or social services, our SSI population, in which the counties don't manage those aid codes, and therefore you're not responsible for any responsibilities associated with that program. So we got a lot of feedback from our social services departments a couple years ago, and the JI screening portal was also created as a result of shifting that workload from our social services side.
Perfect. And one more quick clarification. Those notices of actions that are generated through the portal, will they be sent to the correctional facility so that they can pass them on to the inmate, or would they go to an address on file?
They're going to the either the mailing address or the residence address on file. Our policy in ACWDL 2404 encourages and recommends, especially for our youth population, that the correctional facility address be added as the mailing address during incarceration to ensure that those notices are going to the appropriate area and the member is actually able to receive them during incarceration. There are a couple nuances within that ACWDL regarding the notices, especially for our youth and individuals on a household case. So definitely check out ACWDL 2404. Our master incarceration policy letter we issued earlier this month should address all of that.
Can you give me that a little slower?
ACWDL, All County Welfare Directors Letter 2404.
2404. Thank you very much.
Yeah, that covers all of the pre-release application processes, our policies on suspension of benefits, and as well as the county and state MCIEP or Medi-Cal inmate eligibility program. So it's one of our big policy letters for incarceration policy on the Medi-Cal eligibility side. Thanks.
Fabulous. Thank you.
Back to you, Maya.
Sarah. Thanks, Ron. I think, Sarah, we've got another question that is in your wheelhouse, so maybe we'll stick with you before transitioning to a couple other topics in the Q&A. The question is asking if individuals after release. So individuals who are receiving services post-release from county behavioral health plans will still have the JI aid code applied to them, or if their aid code will change to a non-JI aid code.
So all of our individuals enrolled in the JI program will have to have Medi-Cal in order to be enrolled, right? So that means that they're going to have a Medi-Cal aid code associated with their, what we refer to sometimes as their primary eligibility. So in addition to JI, they will always have a secondary aid code, sometimes more than two, running concurrently. So the JI aid code is going to work just like our other inmate aid codes, where it will only be active while the individual is incarcerated. So upon the release of the individual, the JI aid code will terminate, or upon termination, depending on which comes sooner, it will terminate, and then their primary aid code will remain active once if there was a suspension applied, once benefits are active. If a suspension was not applied, then that primary aid code would be active on release. I see another one that Jenny sent. Do you want to
Yes.
do that one? Okay.
Lots of questions in the wheelhouse. So there was a question from someone asking or noting that they heard from their county agency that they will need to reevaluate every single inmate to trigger a change in meds, and was hoping to get some clarity on whether that was accurate.
So that's a little different than our JI program and policy. And this relates to what I had just mentioned in All County Welfare Directors Letter 2404. So during incarceration, an individual is, if they're in a household by themselves or the whole entire household is incarcerated, they're not subject to that annual renewal process during incarceration. However, upon an inmate's release from incarceration, the County Social Services Department is required to do a redetermination of their eligibility to ensure that they remain eligible if one was not done within the last 12 months. So an eligibility determination can be done at application, change of circumstance, or any during that annual renewal. So the county would only need to reevaluate their primary eligibility if that has not been done within the 12 months prior to their actual release. For many of our populations, they're going to be in and out, and so that eligibility determination would not need to be done every time they're released.
Great. Thank you, Sarah. All right. I think we will switch gears a little bit. Oh,
Excuse
yes.
me. Yeah. Since we're on the JI portal, may I share some experience as the first county to interact with the JI portal? We have a lot of challenges, and most of the issues have not been resolved. And I want to hear the comments about, so the JI eligibility and active status is entirely hinged on the staff manually enter and maintain the JI portal. So we encounter challenges is because often the patient, we call them patients, the release date is unknown. So we enter a patient's information based on the expected release date 2 days ago, but the patient was, the release date was delayed. And then 1 day later, when we went back to the portal, try to update that date, it would not work. It will completely would not work. Instead, asking us to re-enter the information, kind of the termination, what's happened on the day that we initially thought the release date was, and then we have to reactivate, or not activate, we enter a new episode and then end the release date. And we have it's very concerning, because what if, let me pose this scenario and see how the eligibility and the different A codes, JI versus non-JI, will work. We enter a patient into the JI portal with the expected release date tomorrow, the 11th, which is Friday. The patient was released on Saturday, the 12th, the 12th, but there will be no staff manually maintain the JI portal, and the patient now it's released with still in the JI portal shows the as a JI active, them going into a regular community, say for example, an urgent care, what will happen on that patient's A code, and will that impact their benefits and cause challenges for other healthcare providers in retrieving the information through RTE for the coverage. So I think those is one of the many challenges that we have experiencing with the JI portal. As of today, we have met with technical teams, as well as the eligibility enrollment teams. Many of these questions technically through the JI portal have not been resolved. I just want to pose those questions to the state to let everybody kind of share the experience with everybody and how that will resolve on the patient's coverage and the integrity of the individual's coverage on the data front.
Hi, May. This is Sarah Linder. I think we, while you may not be aware of some of the technical resolutions, we have been working very tirelessly to try to work through some of the bumps as we go through. Being that you guys are just one of the 3 counties that are going live, we kind of anticipated and expected some of this. I think some of it is a communication and understanding how the system processes things. It's not always going to be real time, and I think that's one of the challenges. Some of us on the eligibility world, we're familiar with our med system. It's 40 plus years old, and things do take overnight updates a lot of the time for things to be reflective. So our technical teams are working on some resolutions to address those instances and issues that you have raised to us. So please know that we are working through that, and we will be communicating with your county and your partners through those channels. And as any best practices or items are identified, we'll do our best to communicate those out to the larger groups. In instances in which you are putting in a release date, that will be the date that the aid code terminates. So if the release date is unsure or is not identified, especially when it's a period of a handful of days, we would recommend submitting the screening outcomes without a release date. Then at least at that point, your benefits will remain. And once the individual releases, you can go back in and terminate. But we will definitely ensure that we're sharing best practices and any resolutions that we identify with your team, as well as the larger group once those are fleshed through.
Oh, appreciate it. Because we met with the technical team just this morning, and it's still pretty clunky. So thank you so much to actually looking into this.
Yeah, and just keep in mind, we may have some timing limitations that are going to exist with the system. So we'll do our best to ensure that those are clearly communicated so that everyone's aware of what to expect when using the system.
Okay, appreciate that.
No problem. Thank you.
Thanks, May. Thanks, Sarah. All right, I think there was a question answered written, but I think it would be great to just speak it a little bit out loud. It's a question from Tanya asking about services provided by health workers in the jail setting who are not community health workers and what is billable. I saw Ashley, you put in a response, but I think it'd be helpful to say out loud due to the importance of the topic.
Hi, good morning. Yes, well, I can't get into details about the specific provider types that are eligible for those services. That might be something that's best addressed maybe by the benefits division. But what I could offer is that there is a new JI service, section in the Sorry about that. There is a new section in the Medi-Cal provider manual for the Justice Involved initiative, and there is a section in there that goes over the provider type. So I would recommend referring to that.
Thanks, Ashley. I mistakenly thought you were referring to the policy and ops document, which wasn't answering my questions, but I realized that you were referring to a different document. So thank you so much. And I'm looking at that now.
No problem at all, and I apologize for the background noise. Yes, so in the policy and operational guide, I was referring to that section if there was any confusion about the types of services that are covered for GI, but
Got it.
the
Yep.
Medi-Cal provider manual will go over those provider types.
Got it. I appreciate it.
Yeah, no problem.
Great. I see we have one hand raised. If the person would like to come off mute and ask their question, should be able to.
Hi, good morning, everybody. I have a question with regards to the GI code appearing on the GI screening portal. How long does it take for it to show up? And with regards to the SSA question, actually, I was told that in order for SSA to have the GI code trigger, they would need to run each application or applicant who comes into the jail on a daily basis so that it triggers the meds to update the system. Is that correct?
I can take this one, Maya. So I think we're confusing two separate processes. So in 2023, January 1st, 2023, DHCS and our county correctional facilities implemented pre-release application processes. These processes were outlined in the policy letter I referenced earlier and did drop in a response, ACWDL 2404. This policy requires our correctional facilities to screen and identify if individuals are already enrolled in Medi-Cal or would like assistance with enrolling in Medi-Cal, and then assisting those individuals with the Medi-Cal application. So that's really the pre-release application process, and that's likely what's being discussed as part of that, right? So in some counties, how that's working is that the correctional facilities are sending a list of daily individuals that are incarcerated to the social services departments. They're screening those individuals and identifying those that are not already enrolled in Medi-Cal, and then they're enrolling them in Medi-Cal. That is a separate process from JI and our Justice Involved Initiative. So under the Justice Involved Initiative and the 90-day pre-release program, an individual already needs to be enrolled in Medi-Cal. So that first part has to be done. And then the correctional facility would use the JI screening portal to report the healthcare outcome. The first step that that portal does is check our Medi-Cal eligibility data system to verify that the individual that you're reporting is on Medi-Cal and meets the minimum criteria for the program. If you say, yes, this individual has this healthcare criteria and you provide the accurate information with the effective date, that will give you an approval. The JI aid code would then be applied and active depending on the effective date, but active going back to that effective date that's identified. So once the JI aid code is active, and as we mentioned, those overnight processes that occur with our med system, that JI aid code would then be reflected in our eligibility verification systems for Medi-Cal providers to verify, and as well as our med system. So the county social services department would then see the JI aid code in meds, but the social services department does not have to do anything in order for the aid code to be activated by the correctional facility, as long as the individual is already on Medi-Cal. Does that answer your question, or do you have any follow-up?
Can you hear me?
Yes.
Hi, yes, so just to clarify again, so you're saying that if so the reason why we go into the GI portal is if the inmate has Medi-Cal, an active Medi-Cal, and has a chronic condition, correct? Then we go into the GI screening portal and we complete the application for it. So you're saying that will trigger meds, and meds will then trigger the screening portal with the new JI aid code?
In a technical manner, yes, there's a lot of stuff that goes on behind the scenes, but meds is where all eligibility resides for Medi-Cal. So if you're reporting to the portal, so anyone that's on Medi-Cal should be screened for the health criteria and those outcomes reported, not just individuals that are approved for the program, but all individuals that are screened should be reported through the portal so that we can send those notice of action as well as turn on the aid codes for those that are approved.
And so social services would not need to reevaluate every single inmate who has Medi-Cal, an active Medi-Cal, and has a chronic condition.
No, that is not a function or a component that is a responsibility of the social services department. That falls to the correctional facility or their designated or delegated entities that they're working with.
Okay, thank you.
I have a follow-up question to that, if I can ask it.
Go ahead.
Yeah.
So last week we were told that social services needs to adjudicate which JI code is entered though. So where does that come into the workflow?
That is an inaccurate statement. The
Okay.
social services department is not managing these aid codes and has no responsibility associated with the JI program from the actual aid code and adjudication process. That's all done between DHCS and the correctional facility through the screening portal. Very similar to our presumptive eligibility programs where the providers are putting the information directly into our presumptive eligibility portals and we turn the individual, we activate the individual's eligibility and meds.
Okay, I took that training, but I obviously haven't entered anything into it yet. So just answering those questions in the JI portal will spit out a JI code for us to utilize automatically.
Yes, if the individual is on Medi-Cal, then you'll get to the point where you enter in that criteria, and based on that, you will have the JI aid code for anyone determined approved.
Okay, that sounds easier. Yay, thank you.
Can you clarify where that statement was provided, just so
During
that we can
office hours last week.
Okay, we'll ensure that we're clarifying that moving forward. Thanks for raising it.
Thanks all. I think we're going to pivot a little bit away from the questions that we've had. And we got a question in the chat asking for a little bit more information on how level of care for a member is coordinated between correctional facilities, county behavioral health agencies, and the managed care plan in the context of short and long stays, and especially in the context of screening for needs. I think I'll pass that one to Megan to get us started.
Thank you, Maya. So this topic is a little bit more nuanced than I think we can cover in this meeting. So if I don't fully answer it for you, Vanessa, I believe, is who submitted it. If you could please email our CalAIM Justice Advisory Group mailbox and we can get a more detailed response. But at a very high level, the screening tools that the correctional facilities are using are to be agreed upon by the county behavioral health agency and the correctional facility. And that is a readiness requirement for both the correctional facility and the behavioral health agency. So DHCS is requiring that level of coordination in regards to what screening tools are being used to identify behavioral health needs, including substance use disorder diagnoses and the need for behavioral health services in the pre-release setting. As part of the Behavioral Health Links process, there is a data exchange requirement between the correctional facility and the county behavioral health agency. And that requires that any pre-release treatment records be submitted to the behavioral health agency post-release provider, so they may review them and see if there's any issues identified with a level of care placement. And so we do require that level of coordination between the two entities. The managed care plans are also part of the warm handoff process. So for them to receive a non-specialty mental health service case or SUD treatment as part of the non-specialty mental health services or the managed care plan benefits, that will be coordinated at that level as part of the warm handoff, which also has a data exchange component. So hopefully at a very high level that answers the underlying question, but if you need a more detailed response, we could also take that back and provide that in writing. I also want to acknowledge that there will be some expanded guidance in this area in the next updated version of the Policy and Operations Guide, which I do see is another question in the Q&A of when that's going to be released. Unfortunately, we do not have a targeted release date for that. We understand the urgency in wanting to receive that expanded guidance, and we are working diligently to get it through its review process.
Thank you, Megan. This is Vanessa. I appreciate you answering that question because I've been waiting for a couple of weeks for some sort of a response. But I guess just hearing from the counties that have already gone live, I'm very curious because one of our counties is going live in January. And just knowing that we do not have a data exchange established yet, it's in the works, but you know, my main concern is continuity of care for these members and ensuring that they get the services that they need, specifically MAT services, and any kind of chronic disease type of intervention immediately. So have you heard anything from the other counties, or if the other counties are on the call, how is it working for them? If you're unable to answer that, because I know we're still gathering information, but any kind of insight would be preferred, because we do have a lot of our county partners who are very concerned about this. So this may help with setting aside some of those anxieties with wanting to do the best for this population with limited stuff still, you know, being built.
Great, thank you, Vanessa. That is all very important context. DHCS has not been very specific in what modality to use, and so we've just let the counties work that out on their local level for what works for them. So I would defer to any counties that are on the line that went live at the beginning of this month. If they have a readily available answer, we invite you guys to coordinate and to learn from each other right now. If any one of those counties just wants to come off mute and chime in, we would love that.
Hi, this is Ron Klinger. I'm not from a county, but I'm from a plan that's been working with Yuba County. I'm with Partnership Health Plan. So our legal team. So first of all, it was clarified in one of the other learning portals here that the correctional facilities are not considered HIPAA covered entities, but correctional medical is. So we can use HIPAA law to support exchange of PHI between jail medical, behavioral health, and our plan in terms of getting people connected to care. We're very much looking forward to the MOU template next year sometime, which will probably help outline some of this from A to Z. But for now, that's the way we've been handling it with the plans, is their contracted providers are the one, they communicate with them and they've developed data sharing agreements with them. And then as HIPAA covered entities, then we can communicate going from there. So that's how our legal has interpreted it. And it's a little clunky, but it's working. When the volume goes up, we have 24 counties. I don't think this will still stand. So hopefully by then we have more guidance. Hopefully that's helpful.
I can speak for Orange County if you'd like. We haven't gone live yet, but our data sharing MOU has been placed since early this year. But the data that we're sharing is really about the inmates' release date status, their Medi-Cal benefits status, those kind of data related items, and not necessarily health information. Our Orange County Healthcare Agency covers both correctional health services and behavioral health services. And that data is pretty much kept in-house. And if that information needs to be shared, like at the JI portal, for example, then we are entering that data ourselves. It's not the correctional facility that's actually entering that data. So we're doing it on their behalf because we have established MOUs for those kind of services. So hopefully that helps answer a little bit for our part.
Thank you so much.
Wonderful. I see, Nick, I see that you have your hand up. You should be able to unmute if you wanted to chime in with a question or if you had additional thoughts on the topic that was just discussed.
Thanks, Maya. I actually have a different question. Sorry, I joined a little bit late. I have joined the last couple learning sessions, and I'm still trying to get a clear understanding of the billing procedures. I know it was touched on briefly prior that it's going to be similar to Medi-Cal fee for service. Can you just talk through what that's going to look like more specifically in terms of how services are going to be reimbursed and the format that those will need to be submitted in? I've heard previously it'll be a Form 837, but didn't know if there's any updated guidance there.
Yeah, do we have anyone on the DHCS team that wants to take this question? Or is this one that would be better to handle with the technical billing team, which I don't think we have on right now?
I don't believe we have any of our technical billing team on the line. I think we would need to take that back. If we could, maybe somebody from the Manat team can jot it down and then get Nick's email address, and we will provide a detailed written response. And we could also resurface this at the next office hours with our answer too.
Yeah,
Sure.
I think the basic answer is that providers will enroll fee for service and will be billing through our fee for service system with fee for service claims. The specific guidance for how to bill, we have some billing training and some provider manual sections that I think we can provide links to in that follow-up response.
Great, thank you. And Megan, should I email you, Brian, Maya?
You can send the email to the CalAIM Justice Advisory Group at dhcs.ca.gov, and somebody will drop that into the chat for everyone as well.
Thank you.
Thank you.
Hi, this is Ashley Deli. I believe it was Nick. I just wanted to add to, there are some additional trainings that are coming up. So I will drop that that link in the chat as well, so that you can get registered for those, where they typically will go over more technical components of billing.
Thank you, Ashley.
Great. We've got another billing question that came through, which I'll ask, but may need some supplemental follow-up. Asking specifically about behavioral health codes that were added from short Doyle into CAMIS fee for service. The person is asking if the same requirements for those codes in short Doyle apply now to those codes in CAMIS.
I may need to call on Ashley to help me with this answer, but I believe all of the same requirements are in place for those codes.
If we're talking about like specific modifiers, things like that, what I'm going to do is I'm actually going to drop into the chat the inbox to address short Doyle billing questions specifically. I think they'll probably be the best subject matter experts to weigh in on that. So I will put that email inbox in the chat.
Yeah, sorry I asked that question. I think it will be very helpful because we compare between the same codes in short Doyle and CAMIS. They have different requirements from provider types, modifiers, and unit of service. They're all very different. So that's why our teams, clinicians are very concerned about what are they going to do. Is it going to be based on unit of service, which is short Doyle model, the same exact code, and then going into CAMIS, which do not have that kind of unit of service requirement. So I think we would like to have a clear map out that would be very helpful, specific for those codes that are migrated from short Doyle to CAMIS under this program.
So May, I just wanted to clarify, have you had an opportunity to reveal one of the published articles that called out the codes that will be utilized for CAMIS for this program?
Yeah, so it's the link that has the list of codes. I can put it on the chat that that specifically is just a list of codes without any descriptions.
Okay.
Just the list of CPT codes. That's why the teams are very confused about should we use the requirements in short Doyle, which you have unit of service, which is based on unit, and based on certain criteria they have a lot of modifiers that specifically listed in short Doyle, or do we base on the regular CAMIS billing criteria, which do not normally have unit of service if you provide 31 to 68 minutes, that no, you're using one code. So those kind of nuanced, we would appreciate the guidance. And I want to follow on that question is the behavioral health services provided inside correctional facilities can be a little bit challenging in that one is this, I just mentioned about this code. And second, there is a specific code that is I believe it's T2024, which is used on bundle code second, which is also a code in short DOIL. So those kind of clarification, we would like to have an expertise to help us walk through this process.
Okay, so what I will do then is I will drop the link in the chat for that inbox to reach out to the short DOIL team for specific questions pertaining to short DOIL. And I did want to share that the teams are working to maybe put together some illustrations of like a walkthrough of what might be billed, what services are billed, you know, via CAMUS fee for service versus those that are billed short DOIL, because the only time short DOIL is billed for this program is that receiving end of the behavioral health link.
Yes.
So all pre-release services otherwise would bill within CAMUS fee for service.
Yes, we understand that part. We just need some clarification on how the codes behave, the same set of CPTs behave in CAMUS versus in short DOIL, because those codes are migrate from short DOIL to pre-release JI. We just want to have a clear standard on those ones. So the clinicians will know, do I apply for 2 units of service, which is in short DOIL after release, or do I now in this CAMUS environment, do I then follow the CAMUS environment? Because it's often the same clinician to provide pre and post release. So we just want to provide clear guidance for the staff when they drop the code.
Okay, sounds good. And then Manat, let's take that piece of the question back as well. I'll provide the contacts that I have now though in the interim, May.
Thank you so much.
Wonderful. Thanks all. And just want to say, I see a couple questions coming in asking about getting the PowerPoint presentations that have been done for these learning collaboratives. The team is working to get all of this information posted on the website, which we can place in the chat, but has to go through a couple processes. If you are in need of the presentation or want to review it, please reach out to the Justice Advisory Group email, and it can be provided to you via email so you can have it in hand, but it will all be on the website. Just wanted to say that out loud because I saw a couple questions come through asking for presentations. So those are forthcoming, but please reach out via email if you need it sooner. And you can reference Jody's message in the chat, which is very helpful to describe the process. All right, I think we've got a couple questions asking about eligibility for the reentry program, and was wondering if someone on the team, I saw Sarah, you answered a few in the chat, and also the OSP team just wants to give a quick overview about the eligibility criteria for the initiative, just to make sure that everyone hears that and then knows where to reference in policy guidance to get a bit more detail if they need it.
I'm going to defer to OSP on this one just because I'm not as fine-tuned on this.
I may be able to take it. We normally have a slide that guides this type of discussion, and regrettably, we don't have it as part of the slide deck that is readily available for today. Sorry, words are hard right now. And so there are a set of covered pre-release services. Obviously, eligibility for the program, they must be Medi-Cal eligible, part of an eligibility group for Medi-Cal or a CHIP eligibility group. They must meet a set of medical screening criteria if they are considered an adult. That is like a 30,000-foot view of it. There are more details associated with those requirements that can be found in our policy guide. I'm looking for the section right now. When I find it, I'll drop it into the chat. As far as the actual covered services, trying to find those. Let me see. So care management is covered. Physical and behavioral health clinical consultation services are covered services for the 90 days. Laboratory and radiology services and medications and medication administration. MAT medications for a substance use disorder. Community health worker services, and then services provided upon release. Just want to note the community health worker services must be provided consistent with the community health worker Medi-Cal state plan specifications and by an in-reach provider. So hopefully that very broadly answers the question. If you would like a more detailed response along with like section references of the policy guide, we would be happy to provide those as well. Please just email our CalAIM Justice Advisory Group mailbox and we can get those out to you.
Yeah, I'll just say we do have specific condition eligibility requirements, but it is really quite broad. Chronic conditions, pregnancy, mental health, substance use disorder, and sort of a catch-all category called significant clinical conditions. So, and all that guidance is available where Megan said to look for it.
Great. Thank you. And I think we're going to pop in the chat exactly where you can get the specific eligibility criteria and services covered, so you can have that as a reference going forward. I see just a few questions that have not yet been answered. DHCS team, if you've given a written response and want to speak it out loud, please chime in. I see we have one question about enrollment in the provider portal and the need for PAVE approval. I believe that we need to take that back for some SMEs, but just want to be sure that that is the case with the team. Is there anyone that wanted to take that question, or otherwise we'll take it back and respond at a future office hour?
I'm not sure if we have anybody from our provider enrollment division on the line, and those would be the individuals that would best be able to answer this question. So we will go ahead and take that back and provide a response in writing as well.
Fantastic. And then I see one final question asking about a modifier for use when claiming for post-release services to Short Doyle Medi-Cal. Is that something Ashley or others want to address?
So I'm gonna put the same inbox in response to that question as well to reach out to the Short Doyle SMEs as a good starting point.
I'm just going to put a plug in again for the billing guidance training that we have and the provider manual. And all of that information about what codes and what modifiers to bill for specific services and who can bill should be included in that guidance and training.
And those links are in the chat as well.
Fantastic. All right. I believe that we've gone through all of the questions that got submitted via the Q&A. So I think thanks to all those who asked and the team for providing responses. I think I'll turn it back to Megan and to Greg to wrap us up.
Just want to extend a great thank you to everyone who participated today. Learning from each other is very important as we try to advance this initiative and implement across all the counties. And so we appreciate your attendance not only to today in the office hours, but to all the learning collaborative sessions as well. Please refer back to that calendar earlier that we shared earlier that shows all the rest of the trainings for the rest of the year. And then once we begin the new year, we'll have some more learning opportunities that we'll publish at that time. I'll see if Greg wants to chime in and say anything, and with that, we'll just wrap it up.
Megan, thank you everybody, Manat team and all of the DHCS team. We're working very hard and diligent here to ensure we can get these questions answered. I do understand a lot of them, they're multi-leveled questions, and sometimes we have to take them back to get a better response for everybody, but we're all working together. So just know one of the famous sayings here at DHCS is we're building this plane as we're flying it. And trust and believe we are working very hard to build this plane to be a great plane to fly. So as you're asking questions or coming up with more questions in the county or as our constituents, you can always reach out to our CalAIM Justice Involved, our email address, sorry, CalAIM. Man, I put it in the chat. I can't find it. Advisory group email and ask your questions, because we normally are better off at taking that back and getting those questions answered as soon as possible. So I appreciate you for being here, and we'll see you on the next collaborative. Thank you so much. Thanks, Maya.
Thanks, you guys. That was incredibly helpful.